Emily Smith, she's a military veterans point of contact and director of the community engagement for the Charlotte-based Cardinal Innovations Healthcare. She oversees with education about Cardinal Innovations to the community. In her formal role with Cardinal Innovations, she was director of the NC Serves Metrolina area and helped with the Raleigh-Durham Fayetteville NC Serves network as well. She has over 13 years of successful leadership and management of behavioral healthcare organization and worked as a clinician prior to transitioning in direct behavioral healthcare. So here's Emily, and I'm going to put her PowerPoint up.
Good afternoon. Do I have to, can you hear me here? Gotta hear me here? Really? Yeah, that'd be great. Cool. So we're going to start off by, thanks for having us, actually, and Moses is going to keep me on time. Wanted to talk about what an LMAMCO is. So if you work for the division, you're not allowed to answer this. I'm getting a mic. And if you work for the LMAMCO, you're not allowed to answer this. But who knows? Who knows what an LMAMCO is? Yeah? Okay.
The ones that run the healthcare, the mental health care, and all that for the counties.
Anybody else want to add? Coordinate care among a provider network. Anybody else? I was supposed to have gift cards, so it's the thought that counts. I meant to do it. I forgot to pick them up. My bad. They were like $100 gift cards. I'm sorry. Forgot to pick those up. I'm going to move forward and talk to you guys about an LMMCO. You guys just heard your audience share what it is. The PowerPoint has hyperlinks embedded into it, so I'm not going to read these slides word for word, but we are under contract with the state to provide management and oversight of the public system for mental health, substance use, and intellectual and developmental disability services at the community level for folks that receive Medicaid or who are uninsured or underinsured. And so, again, we're responsible for management of state funds as well. Is serving veterans within the scope of an LMAMCO? So, the answer is yes, based on general statute, which I've included in these slides, and I'm not going to read word for word these slides, but the things that you're going to see jump out at you in these slides is we really were tasked with developing a veterans point of contact, military veterans point of contact at each LMAMCO. There's 7 across the state, and so there's 7 of us. The other primary responsibility that we had is every one of us have a toll-free crisis line. We're available 24/7, 365. Those staff that answer the phone are supposed to be subject matter experts in the number of persons we can serve in the counties that we manage, as well as the type of services that are available to them. And so, again, we have to educate those folks, make sure they're trained. And then we're also responsible for linking folks to community resources. And there's thousands of community resources in North Carolina. So over the past couple of years, we've been able to really coordinate those efforts with NC Serves that you'll hear about later. And these next few slides really talk about what we're required to do. And I wanted to make sure I included this for you guys so you would know, so you can hold us accountable to it. So if you know what we're required to do and it's not happening, the very last slide gives you all of our points of contact and our information. Let us know, challenge us. We want to be better at what we do. You will see here primarily the most important thing on this slide is it really tasks us with serving folks that may fall through some gaps. So an existing gap, someone who may have been other than honorably discharged and they have X amount of services that they can get with the VA, then what happens with them? They can come and receive services in their communities. Contacting their LMAMCO is the great place to start. We can screen them. We can link them to services either that we manage or that are available to them in their communities. Additionally, that you'll see here, we're responsible for making connections with folks that serve veterans in our communities so they know who we are, we know who they are. You will see also other things here. Again, just included it, not going to go through these word for word, but please hold us accountable to these measures. And if we're not, let us know, let the state know. We're happy to hear it. One of the most important things, too, is we have a protocol with the National Guard, and it's the crisis protocol. So anybody that calls our call centers, we're going to make sure that they're screened for an emergent behavioral health issue. We don't really care who you are or where you're from or if you can pay or if you can't pay. And we don't really even care if you're a veteran or not. We're going to get you connected to crisis services. If you are a member of the National Guard, though, we will go an extra step and involve them in your care. And this slide really defines what that is, and it's important for you guys to know that as well and share that with folks in your communities. So, talking about crisis services, is everybody familiar with mobile crisis? Have you ever heard of mobile crisis by a show of hands? Okay, cool. Every county in North Carolina has mobile crisis. Mobile crisis is a service that's paid for with Medicaid dollars, state dollars, and if the provider that's providing it contracts with Blue Cross Blue Shield, then Blue Cross Blue Shield can potentially pay for it. But everybody in North Carolina is eligible for mobile crisis services if they're in a behavioral health crisis. And these are providers that respond 24/7, 365, and from the point of time that they call the provider or they call the call centers, the LMAMCO call centers, they have up to 2 hours to respond. 2 hours is a long time, right? It's not like medics who can come out and be there in like 3 minutes, 7 minutes, 21 minutes. Generally, our response times aren't 2 hours, but it's important for the community to know they have up to that amount of time because we may have one person serving a rural area that needs that time to be able to get there. But these are clinically trained staff that go to you wherever you are in the community. So they don't, pick up the phone, say, hey, where are you at? Go to your local emergency department. I'll meet you there. They are to meet you where you're at, even if it's in the parking lot at McDonald's. They're going to come to you and serve you. So one of the things I was going to do, and based on time, I'm not sure I have it, but I've included a hyperlink here to the Crisis Solutions NC.org website, which is chock full of information from the Crisis Initiative through the Department of Health and Human Services. On that website, it's a drop-down by county, and it lists our toll-free crisis lines, which I've included in the last slide of this PowerPoint. It also includes who your first responder is in that county, and that's going to be that mobile crisis provider. You can call them directly, or you can call your LMAMCO and connect to that. Again, that website's chock full of information, so if you've been there, cool, give feedback. If not, go to it and check it out. And I've been mentioning the toll-free crisis information referral lines. Again, we're 24/7. And, we're going to ask you, once your crisis is stabilized, if you're ours, and we can link you to care. But if you're not, let's say you're privately insured or insured through TRICARE, we're still going to help you connect to services. Okay, other than honorable discharges, I mentioned this just a little bit ago, but we are the folks that will help bridge that gap in services. We can bridge services while you're waiting for services at the VA, and we can provide services once you've exhausted those if you are an eligible member for our services. And again, that's someone who is Medicaid insured or otherwise insured or uninsured. Now, you can be insured and not have mental health and substance use benefits through your private insurer. Then that would make you uninsured or underinsured and potentially eligible for our services. Again, we're responsible for that coordination of community resources, and so I've included some really important hyperlinks here, too, that I think if you ask my call center, what links do they go to most frequently when they're trying to link veterans, it's these. It's these 4 resources. And you heard from a gentleman here. He's on one of the boards in the Triad for the Community Veterans Engagement Boards. I'm on the board in our Piedmont region. And then we have, I think there's 7 boards across the state. But that Facebook page will link you to those resources as well. NC Serves that you're going to hear about. And then here are our points of contact. So everybody is responsible for having a me at their LMAMCO. And what we decided, and we talked about it collectively, call our 1-800 numbers because they're available 24/7. They're going to get you connected to services immediately, and then they connect you to us to help you with navigating the system. So, bam, I didn't even get, I didn't even, oh.
I'm going to steal it just a little bit. Emily, thank you very much. If we could have, we've got Meredith Comer is here, and she is